Good morning, dear patrons. As we all are aware that October is celebrated as World Sight Day, and it is celebrated on every second Thursday of the month of every October. And this time, we also thought of sharing some few tips and preventive methods which will help us to protect and take care of our eyesight. And I thank Santan Mission to conduct this program and to spread the awareness about it. Now, as we know, eyes are the windows to the soul, and of we always say, "Aankh hai to jahan hai." When we look to the world, we see through our eyes. We connect with others through our eyes, and when we see good things, we feel happy also. And do you know that 80% of the memory is through our eyes? Now, on this World Sight Day, as it is a global event, it is basically done to attend the blindness and visual impairment in the whole world. This World Sight Day is celebrated all over the world to create awareness about eye care, vision blindness, and treatment which are involved to cure eye impairments. This day focuses to uh, focus on main causes of blindness like cataract, glaucoma, refractive errors. And the good part is that all these are treatable and can prevent blindness if detected on time. Now, as we look at these figures, why it is important to create an awareness? Because globally, 2.2 billion people have unaddressed visual problem. And if we don't treat them on time, it can lead to more blindness. And there are a lot of studies in India. It is shown that as per recent survey, approximately 2% of the Indian population is blind. And one of the leading cause of preventable blindness is also corneal opacities. And it is seen that 1.1 million people in India are blind because of the corneal blindness. And there are around 1 lakh corneal transplants are required, but currently we are only having 25,000 of corneal transplant happening annually. And this is a very alarming figure where we need to raise awareness about preventable and treatable blindness. Now, what is sight? Sight is what we see, and then it gets interpreted into the brain where we see the image which gives us vision. So suppose if this is the object which forms a focus on the eye, this object when we see it is inverted, and then the brain has components which fuse this image and make it invert, and then the final image is seen. So this is whole concept gives us the concept of sight and vision. That is what we see, and then what the final image we are able to interpret. So protecting our eyes and our sight is highly important. Now, when we look at the figure of this eyeball, this is a normal eyeball which is spherical in shape. The components which help us to give vision are cornea. This is the front part of the eye which is very transparent through which the light goes. Then the lens which helps to focus this light image which is gone, and this light falls on the retina, and through this retina and optic nerve it goes up to the brain. So these are the four main important parts of the eyeball which help us to see, which helps us to form an image which goes up to the brain. That is cornea, lens, retina, and optic nerve. Now, if there is any disturbance in these pathway, that is called a visual pathway, then it leads to vision problem. We will just discuss what are the common important visual eye problems and what are the symptoms and how we can prevent it. Now, the common eye problems which are seen, we can divide into two, that is in children and in adults, of which the commonly are refractive errors, which are like astigmatism, myopia, and hyperopia. Now, this why we are focusing, because it is seen that around 10 to 12% of the population do have refractive errors. And these are the conditions in which if we don't treat on time, it will lead to visual impairment. Then second, coming to dry eye, this we'll deal in detail because nowadays this problem is increasing because of lot of pollution, screen exposures, improper diet, improper sleep. So this all can lead to dry eye. Then digital strain syndrome, where because of COVID, we all are confined to our houses, so we have increased our digital screen time. Allergic conjunctivitis, color blindness, or night blindness. Some other common eye problems which are seen in children are lazy eye, that is also called as amblyopia. Then where the lid comes down, which is called as ptosis, and when there is a squinting or crossing of the eyes called as squint. Now the common eye problems in elder people which we have seen is presbyopia, that is after the age of 40 years, when your muscles, they start relaxing, they are not able to focus, and for the near vision. So most of the people after the age of 40 years will require glasses. So one should not worry that, oh, I am becoming 40 years old now, I am not able to see. Don't worry. If we correct your vision on time, give you a simple spectacle glasses, you will be able to read and move on your work. And second is cataract, glaucoma, age-related macular degeneration, and diabetic retinopathy. One by one, we will deal with all these common problems. Now, myopia. What is myopia? So this is the normal eyeball which you can see, and the ray of focus is formed on the retina. That is, the focal point is there. Now, what happens in myopia? This eyeball is a bigger size, so this focal point is formed in front of the retina. So whenever you see, you have a blur image, like this is a normal image and this is the blur image. So the eyes, as the focus of point is not formed at a single point, it will lead to blur image. And then the simple remedy is like you give glasses and wow, it will give you a clear vision. Usually it is seen that it runs in family. If any of the parent is having glasses, then there are chances that 30 to 40% of the child will have refractive error. If both the parents are wearing glasses, then the chances is high, that is 60 to 70%. And if none of the parent is wearing, still around 10 to 12% of chances is there that the child will develop myopia. And nowadays, we are seeing more myopia, and it is also increasing because the near work of children is increased a lot. So if children are going out, playing outside, they are there in the sunshine and playing more outdoor games, then the chances of developing myopia is less. But if we are confined more indoors and we don't look very far off, there's no sunshine, then there is the chance of myopia increasing. Usually myopia, it is also called as school myopia because it gets noticed after when the child starts going in school, like at the age of 5 to 6 years. And what are the common problems with the child can face that he's not seeing properly? Because child will never come and say that I'm not seeing properly. For them, the world appears like that. So if you feel or if you see that a child is going near to the television to watch the TV, or taking the books very close, or is not interested in studies, or squinting, complaining of headache, rubbing his eyes frequently, then one should always be alert and think that the child might have some refractive error. It can be myopia or hypermetropia. Myopia is corrected by minus lenses or contact lenses, and nowadays we have good surgeries available to remove the spectacles after the age of 18 to 20 years. So one should not worry. If it is treated on time, then it can prevent future blindness because of refractive error, and we can prevent lazy eye also in the children. Now, hypermetropia, in this, what happens? The eyeball, which is normal in size and spherical, here the eyeball size is small. So the ray of focus, that is the focal point, is formed behind the retina. So in this, what happens? The person can see far off, but usually the near vision becomes blur. So always this person will have persistent headache. They will not have uh, interest in studies. Then the lines may appear double, or they may appear crooked, or there if the child will start squinting a lot. And also it is usually the child will complain of headaches whenever they are reading. So this can happen with children also, in adults also. Sometimes it is seen in adults when they are young, they are able to uh, uh, they are able to focus because of the internal power which they have. But as they grow up, like after the age of 25, 30, this hypermetropia becomes manifest. So they may start again having problems when they are reading or they are on computers. So again, this hypermetropia can be corrected by spectacles, contact lenses, or surgery. One part of hypermetropia is that if it is in during childhood, and if the vision is not corrected, then it can lead to lazy eye, and then the treatment of lazy eye has to be given. Now, what happens in lazy eye is that the vision, the child, whichever whoever is having vision, the vision may be less in one eye and normal in one eye. So when there is a difference of vision in both the eyes, then the one eye is forming a blurred image, another eye is forming a good image. So the brain is not able to fuse both those images, and the eye which is weaker becomes lazy. It that means it starts ignoring the objects which are there. So the brain is not able to focus, and then this is called as lazy eye or amblyopia. So this is usually associated with refractive errors, and the good part is that it is corrected. It can be corrected if caught on time. Now, what we say caught on time, that is as early as 1 or 2 years, because the vision which forms in a child gets completed by the age of 6 to 7 years. So we need to detect this problem before that. Because if the problem is detected after the age of 7 to 8 years, then it becomes difficult to treat this lazy eye. And the child will have that lazy eye lifelong, which we don't want. So refractive error is a very simple eye disorder, which corrected on time, we can prevent having lazy eye in a child. Usually, how we can say that the child can have lazy eye is that, so now, normally whenever you are seeing a child, always see in your children and ask them to close one eye and then see that if they can see equally in both the eyes. One can ask a leading question also. And if the child says or starts squinting to see it, then we can suspect a lazy eye. So it is very, very critical that early diagnosis is made so that the lazy eye can be treated on time. And usually what we do in lazy eye, we prescribe spectacles, and the good eye which is there, it is patched, like you see in this photograph, the child's eye is patched for some time. And depending on the age, there are different methodologies available where we ask the children to patch the eye, and then the main focus is formed by the poor eye and it starts seeing. The very good results are seen with this type of patching if the compliance of the child and parents is good and follow-up is there. Usually we try to say to all the parents, that is why we always focus that all children should have their eye screening done in preschool age. That is before going to school. All children should get their children detect for a check for refractive errors by an ophthalmologist. Why? Because if we find lazy eye, we can nowadays with good patches available, good exercise therapy available, we are able to tackle this lazy eye much better what it was before. Now, so first we saw myopia, then comes hypermetropia, then third is astigmatism, where the focus of the point is not formed at single point. It is formed at multiple points. Okay, so here, why it happens? It can happen because of irregular cornea, which is there, that is the corneal shape, normally which is spherical. It is not smooth. It can be big in one meridian and small in one meridian. So the focus of image which is formed is not at one single point, it is formed at multiple points. So again, this astigmatism can develop at a younger age also. Usually it does not develop at a bigger age, like after the age of 18, 19. So usually it develops in younger children only. That is why many parents come and say, oh डॉक्टर साहब इतने छोटे बच्चे को कैसा चश्मा लग गया. So we tell them, हम यही बोलते हैं कि जो चश्मे का नंबर लगता है वो या तो बचपन में लगेगा या जब बड़े 40 साल के बाद होगे तभी लगेगा. तो इसी वजह से बच्चों का आई चेकअप कराना बहुत जरूरी है, क्योंकि ये वाले प्रॉब्लम्स जैसे मायोपिया, हाइपरमेट्रोपिया, एस्टिग्मेटिज्म, ये सब हम प्रिवेंट, इसकी वजह से जो ब्लाइंडनेस होता है वो हम प्रिवेंट कर सकते हैं. Then comes squint. Now squint is very obvious, जिसमें what we see is that the eye gets crossed. It's crossed. You will see that one eye is looking straight and another eye is either looking inside or outside. So why does this happen? Number one, if the vision is not good in the eyes, then it can lead to this squinting problem. So it is related to visual refractive error, which we discussed earlier. It can be because of the weakness of the muscles, or it can be because of any injury to the eye. And it is seen in some families that if parents are having squint, then it can run in children also. So how we have to tackle it? First is always a checkup where we put the medicine in the eye and then see if the child is having any refractive error. So if the child is having any refractive error, we need to correct that thing. If it is because of muscle imbalance, then surgery is required. Sometimes it is because of both. It is because of the refractive error also, and it is because of the muscle imbalance. So always first we need to refractive error. Most of the squints which are because of the refractive error, and if the child starts wearing proper glasses and very regularly, then the squint goes away. So again, this is a preventable aspect that we need to treat it on time. Again, we have seen in some children by birth, the lid comes down. ये पलक होती है ना, वो नीचे हो जाती है, तो उसको हम ptosis या droopy eye भी बोलते हैं. So this is why it happens. It happens either because of muscle weakness in the lid. की जो muscle यहाँ पे होती है, जो पलक को ऐसे ऊपर उठा के रखती है, वो वहाँ की weak होती है. It becomes weak. That is why the lid comes down. Now, this can also run in families. Usually, children are born with this ptosis, because if it happens later on, then it is usually related to either trauma, or it can be because of the neurological brain problem which is there, which is called as neurological. So if the child is having this drooping of lid since childhood, then again depending on the grade, mild, moderate, severe. Usually mild we can just leave it, but moderate and severe will require treatment where the surgery is done to lift this ptosis, and cosmetically this eye can become same as this eye. Now, but if it happens later on because of any injury or any neurological problem, then it has to be tackled accordingly. So whenever one sees that this lid is coming down, please don't leave it like that, because there are many parents who come and say कि ये तो कुदरत ने इसे बनाया है, हम इसको भी क्या कर सकते हैं. So it is not like that. We have good surgical options available to improve the cosmetic results, and sometimes this drooping of lid, when it is very severe, can also lead to vision problem. And usually it is seen that when this lid is more down, it do have associated refractive errors also. So we need to correct the refractive error first and then plan cosmetic surgery for this lid and lift it up. Now, these are the problems which we discussed are seen in childhood. There are certain problems which can happen, like corneal ulcer. It can happen at any age. It can be because of any injury. It can be because of putting any wrong eye medication. It can be because of infection. It can be because of any infection which has happened and it is not treated on time, or putting drops and drugs which are off label and does not have any I would say any expiry date and all. So we have seen like people using those gulab gel and all, as it does not, we don't know what expiry date it is having and what infection it can lead. So we have seen corneal ulcers happening because of that. And it is why it happens, as I discussed, it can be because of the injury. So whenever one has an injury, it has to be reported immediately and treated on time. If not, then it leads to this corneal ulcer, this white part which you can see on the cornea. So this is a severe form of infection, and if this infection increases, it can melt this cornea which is there, it melts away and can lead to blindness. So we have to be very, very careful whenever these corneal ulcers happen. If treated on time with appropriate medication, then it can heal properly. We have seen many people, whenever they get injury, they go to a medical store and then get a drop which usually contains steroids. Now, what happens with eye drops with steroids? This redness will definitely decrease, but it is not good for the organism. It helps the organism to grow more if steroids are given. So again, it can lead to this trauma in the eye. So whenever, so corneal ulcers, how we diagnose? If one is having any injury or there's redness, something has fallen inside the eye, there's discharge, you are not able to look at the light, and the eyelids become swollen, or there's a white spot on the cornea, then you have to report to an eye specialist for it. There are many causes like bacterial, viral, fungal, and parasitic. Depending on what type of infection, the medications are available. And the good part is, with the help of these pharma companies, we are fortunate to have very good medications. And if treated on time and diagnosed properly, it we can prevent blindness because of the corneal ulcer. And so then coming to conjunctivitis, which is normally called as pink eye. This is more common whenever there is change in weather, or during summers, or during rainy season. So what happens? There's inflammation of this white part of the eye. It becomes red, and the blood vessels which are there, they become more prominent or become pinkish. So that is why it is also called as pink eye. Now, whenever there is a conjunctivitis, one will have watering of eyes, foreign body sensation in the eye, there can be a glare problem. So we need to treat this eye to prevent further complications. Again, it can be, cause can be anything, as I discussed. It can be a viral infection, bacterial infection. It can be because of any allergy, or anything which has gone inside the eye and has come out. It can lead to conjunctivitis. Conjunctivitis can be infective, that is because of the infection. It can be because of the allergy. It can be because of people who are working with I would say in industrial thing, where they are working with acids, alkalis, like a lot of chemicals they are working, or welding work where it has been done. So it can be because as an occupational hazard also. So if it is, so one has to take care to prevent that occupational hazard. Otherwise, if the conjunctivitis keep on happening every time, then it can lead to problem, and the quality of the life or the quality of the vision get hampered. So we need to diagnose it properly and treat it on time. How we can prevent it is that practice good hygiene. Nowadays, with a lot of with COVID, anyway, now we have learned to do good hygiene. Sometimes there are good effects of COVID also and bad effects. So we have seen that hand hygiene has improved because of that. So again, practice good hand hygiene. Do not rub your eyes. Do not splash water in your eyes whenever you develop redness. You should not splash too much of water. We have seen that people, whenever the red eye happens, they start splashing too much of water, and this splashing of too much of water leads to more infection. Always, whenever you have red eyes, then you have to clean your eyes with a clean towel or a tissue paper, but it should not be clean with the same cloth every time. And whenever you develop conjunctivitis, please do not share your towels or personal things like eye makeup or mobiles, or basically how is conjunctivitis goes from one person to one person is through the common sharing thing. It does not go if you look into one another eyes. It only goes if you share your things. Like just a simple example, a remote at home. If one person gets a conjunctivitis, all people will touch the remote to watch the television, like children, parents. So this way, the remote, if it has been infected by the virus or by the bacteria, so the person, if you have conjunctivitis, the other person takes the remote and then rubs his eye. So this way, the conjunctivitis goes from one person to one person. So one has to take proper care of the personal belongings which are there at home, and do not share it, please. Okay. And this conjunctivitis, again, it can be treated, so don't worry about it. And do cold compression whenever one develops a red eye. Do cold compression. If you're wearing contact lenses, then it should be removed and it should be stopped. And in fact, that pair of contact lenses should be discarded. The solution should be discarded. Ideal suggestion is that. Otherwise, the conjunctivitis can go on for long. Then coming to a very common cause of visual impairment, that is cataract. And cataract is also called as motiabin, and it is one of the most common cause of treatable blindness. It is related to age-related. It's basically an age-related cataract. It is seen in some children. It can go from families to families, and people who are using steroids for long, again they can develop cataract at a early age. Other causes of cataract can be trauma or any inflammation in the eye when it happens to the early age. Diabetics are more prone to develop cataract early as compared to the normal population. How we say that you have cataract? If you can see, this is a normal vision, and then with cataract the vision becomes very blurry. Some people do have glare while driving at night. The colors a bit appear faded as it leads to decrease in the contrast. And sometimes the class number keeps on changing very frequently, like every 3 to 4, 5 months, the glasses change. So that is why when should one get for cataract surgery? Whenever you are having all these symptoms as I discussed, or if we feel that glare problem is there, it is hampering your day-to-day activity, or your glass number is increasing very frequently, then one can go for cataract surgery. So, and nowadays we have very good surgical techniques available, which are very safe, and these are daycare procedures. So surgery is the only choice for cataract, as there is no medicine available for it. So this is a slide which is showing this is a normal lens which becomes cataractous, and what we do nowadays that through the surgery, this is an ultrasound probe. This cataractous lens is removed, it is absorbed by it, and another artificial lens is placed over it. So there are many people who come and say, "Doctor साहब cataract निकाल दो, lens डालने की क्या जरूरत है?" Yes, there is a need to put the lens, because ये पावर जो हमने लेंस का निकाल दिया वो कहाँ से भरपाई होगी? या तो आपको आगे से चश्मा लगाना पड़ेगा, अंदर लेंस। अगर हम ये लेंस निकाल देते हैं, and if you have to wear glasses, the glasses are very thick. So what we do the measurements and according as per the eye, and then implant an intraocular lens, which again gives you a good vision. And this lenses can be monofocal, bifocal, monofocal or multifocal. So depending on the need and requirement, the lenses are implanted accordingly. Now, another cause of visual impairment is glaucoma. Again, glaucoma is also called as kala motia, and it is also what we call it as a silent eyesight killer. It is silent deaf of eyesight, as there are no warning signs in glaucoma. Glaucoma, mostly it is either overdiagnosed or underdiagnosed. This we have seen in our routine practice. Number two, as people do not have any problem, they do not come for eye checkup. We have seen very rarely, we have seen people coming for routine eye checkup. So always we advise to go for routine eye checkup after the age of 40 years, because this is the age where there are chances that one can develop glaucoma, like 40 to 50 years. Okay. So what is glaucoma? Basically, it is also known as kala motia, which this you can see the normal drainage of the inside of the fluid which is there. It normally drains through this pathway. If this pathway becomes, there is a blockage, or the fluid which is being formed is very more, it increases this pressure inside the eye and gives a pressure on this optic nerve which goes till the brain. So if this optic nerve gets damaged, it can lead to visual problem. Now, glaucoma is basically of two types, that is closed angle, where this angle which we see, the part of the eye is blocked, or we call this an open angle. Now, in closed angle, fortunately or unfortunately, we say, in closed angle, the pressure will increase suddenly and the patient will have pain. So they will come to the hospital because of pain and redness in the eye. So this glaucoma can be caught hold or can be detected. But in open angle glaucoma, as there is no symptom, no pain, no redness, no blurring of vision, and slowly the pressure in the eye is slightly on a higher side as compared to the eyeball. So it compresses the optic nerve and damages the nerve. So usually people have symptoms when around 35 to 40% of the damage has occurred. And again, in glaucoma, it's an irreversible damage. So that is why early diagnosis is very important, so that appropriate steps are taken and treatment is started, and blindness is prevented. And remember, the glaucoma treatment is there for lifelong. So it is not like that you have put the drop and because you don't have any symptoms, so you will not feel that the drop is working or not. Okay, so we have seen many times that people come, they are diagnosed, they put the drops for 3 4 months and stop it on their own. No, in open angle glaucoma, as we don't have any warning signs, as we don't have any symptoms, so you have to come for a proper regular eye checkup, so that your doctor decides upon the treatment. If there is any change to be done for the treatment, it has to be followed on the visits only. So we have to take care about that. So how we diagnose a glaucoma? We take the pressure. This is a tonometry. Then we check the angles which we see. Then perimetry is done. OCT, that is scanning of the nerve, is done. So this perimetry, why we do it? Because this tells us that how is your peripheral vision? How is the peripheral vision of the patient? Because this is what the patient sees. And then we do the scanning of the eye, that is called as OCT, where we want to know that how the optic nerve behavior is there beyond which we cannot see. So these are the certain tests which are to be done to help us to diagnose. And once the diagnosis is done, then the treatment is prescribed accordingly. So either the treatment, it can be in the form of drops, it can be in the form of laser treatment, or it can be a surgery, or it can be a combination, or it depends on the degree of the visual impairment and the glaucoma part which is controlled or not, or and the pathology in the eye. So the drops are easy to put, though the cost of the drops is definitely there, but a lot of medical companies are working on it, and they reduce the cost of course initially, but we have to weigh benefit versus risk. So basically, these drops are given to prevent further loss to the optic nerve. Then laser therapy, as I discussed, we make a small opening in the eye so that the fluid which has been blocked, it keeps on moving and the pressure does not increase. And sometimes we have those tubes and minimal invasive surgeries where if the medication does not, like if the drops does not help to control the glaucoma or the pressure, then we have to give this surgery is required. So surgery is never the first choice. Always drops is the first choice. Surgery is always when the drops are not able to control it. So coming to another visual impairment is age-related macular degeneration, which happens because of the aging. As the name itself suggests, that it is the age-related macular degeneration. It happens as the age advances. It leads to degenerative parts in the macular area. Now, what is the macular area? It is the most developed part of the eye, which gives us vision, crisp and fine vision, which helps us to read very fine prints also. So this is all related to the macular problem. And if there is any problem to this macula, then it is called as age-related macular degeneration. Now, what is degeneration? It means that whatever the toxin parts they are there, they disrupt the normal part of the macula, and then as there is disturbed functioning of the retina, so the new blood vessels are formed to give more blood, to give more oxygenation to this part, and then this leads to more bleeding at this area. So it is called as wet AMD. That is, whenever there is bleeding in this part of the area, it is called as wet AMD, and when it is dry, that is no bleeding, and it's called as dry AMD. So usually it is seen in Indian scenario, if we say it is seen after the age of 65, 70. Some people do develop at an early age if hereditary is there. Is there. Otherwise, usually it develops after the age of 50, 60 to 65, which we have seen. What is the problem the patient faces? Usually driving is a problem. There's reduction in the contrast, and people, whenever they read, they will see a wavy line coming. So all the letters on the newspaper or the reading material, they appear wavy or they appear jumbling type. So whenever one sees this type of problem, you have to report to your ophthalmologist. There are certain risk factors like heredity itself, then smoking, obesity, diabetic. So they are more prone to develop these type of ARMD, age-related macular degeneration. So one, we have to, so this is the thing which I was discussing, that this is a normal vision, and then you see have a patchy vision in the center. So this is the macular area where the fluid gets implanted. Is a fluid that is, it causes swelling, and then this is diagnosed with the help of OCT, that is optical coherent topography, where it's a 3D image of the retina is seen, and then depending on that it's a wet or dry. If it is dry, then usually there's no treatment for it. But if it is wet, then now we have good treatment, injections available, lasers can be done, so that we can hamper the process at that particular uh, time only. Because as this ARMD, wet ARMD is a very progressive disease. But if we do not treat on time, then it can lead to blindness also. Usually patient does not go into total blindness, but it's not a good vision where people are not happy with that type of vision. Then yes, now this is a most important eye disease which we are encountering nowadays. Why? Because diabetes has become a global hub of diabetic people. Globally, it is increasing very fast. So this diabetic retinopathy is also increasing, can happen. It can happen in, mostly it is seen that diabetes, which is there long standing, that is more than 10 years, then most of the people will have diabetic retinopathy if the diabetes is not under control. Diabetics who have poor control, then there is a high chance of developing diabetic retinopathy. What happens in a diabetic retinopathy is that this vessels which are there, they become very thin, and then they start bleeding inside the eye. If they start bleeding, then there is abnormal blood vessels which are formed. Then the eye has to compensate to give nutrition to the retina. So more and more blood vessels form. Now, whatever this new blood vessels form, they are not as strong as the original blood vessels. So as these are weaker blood vessels, it leads to bleeding inside the eye, leads to swelling inside the eye. And if this swelling and bleeding is at the macular area, then it can lead to loss of vision, because these blood vessels can bleed and it can form an hemorrhage inside the eye, and then it can lead to visual impairment also. So how does it normally, if we see this picture, there are no patchy vision. But in diabetic retinopathy, because of these bleeding spots, it can give rise to this patchy vision. So always the patient will complain that they're not able to read, they're not able to focus on faces because they have to keep on tilting their heads left, right, so that good vision, good image is formed. So these are the symptoms which can happen in diabetic retinopathy. The longer you have diabetes and lesser control of the sugar, there are more chances that one can go into more complication of this diabetic retinopathy. So what are the symptoms? You can have floaters in the eye, blurred vision, fluctuation of vision, the color contrast becomes very less, and you can have that patchy vision also in between, as I told you earlier. So again, risk factors is more longer is the duration of diabetes, more is the risk. Uncontrolled is the diabetes, more is the risk. And if you have associated high blood pressure and increase in your lipid levels, then the chances of diabetic retinopathy are more. Of the complication of diabetic retinopathy are very, very high. And also in people who are tobacco users and smokers, then there is normally we say diabetic retinopathy can develop after the age of, like, if you have diabetes, so if it is a long history of 8 to 10 years, then you will develop diabetic retinopathy. But with when all these things are not under control, like your blood pressure, your lipid profile, if you're a smoker, then you can have complication of this diabetic retinopathy more earlier. So you have to always control your sugars, and it's not only the sugar, but overall stress management, overall treatment of your blood pressure, your cholesterol has to be taken care, and you need to stop smoking whenever you have this diabetes, and to prevent the complication of diabetic retinopathy. Now coming to another, so these whatever we have seen till now, they are all things. These are all eye conditions which are, if they are diagnosed on time and treated on time, can prevent visual blindness. That is visual impairment or visual blindness. So the main focus of this World Sight Day is to help you when to go to an ophthalmologist, when do you require treatment, and how to like what are the common things which can lead to blindness. Because if person goes towards blindness, then you have to think of so many things like the socioeconomic condition, the dependency of the patient, of the people on their parents or on their counterparts. So they have to be dependent, and also it increases the cost of the treatment. So if it is detected on time, then we can prevent all these complications which are leading to blindness. Now coming to another part is which we say day to day, like eye strain. Now, the term eye strain describes a group of symptoms where it occurs in some people, where people are having this headache, they are uncomfortable with the eyes, every time they are rubbing their eyes, then they are not happy with their vision, there is fluctuation in the vision, and not, I would say, not able to concentrate on their work. So if this is there, then what happens? It will affect the quality of life also. Okay, so eye strain, though it is a smaller problem, but if you look at from other perspective, it can really affect the quality of life. And nowadays we are seeing people coming with more eye strain because of extended use of screens. And this can be pre-COVID also, and now post-COVID this has increased a lot because most of the people are working from home, or they are working, there are these online classes going on. So basically most of the time I say it is not only online classes, it is the way how we are dealing with it. Okay, so children, parents come and then say, oh, after this online classes, my child is not good, they're having so many headaches and what. So I always tell the patients, please don't blame the online classes. It is a way in which we have to learn to tackle, and we have to learn to live with it. So I'll discuss how we can do about it. So as we see these figures, um, which this is a very nice slide which has come post COVID-19 lockdown situation, that how the people have started increasing their screen time, because people are mostly 25% people are there on social media, chatting is there, then news is continuous news was going on about COVIDs and all those things. So people were stuck glued to their televisions and their phones. So there is increase in the digital viewing tremendously since past 6 to 8 months. So what are the how do you describe eye strain? Usually it is an overexposure to the screen, or uh, I would say to the screen, or any reading habit, or anything which we are viewing from the near. So it can lead to blurred vision or double vision, eye irritation, burning or stinging sensation, watery eyes, redness, headache, feeling of disorientation, and difficulty in focusing. These are very, very which I told you, quality of life when we see. So we have seen so many people coming in a depressed mood कि डॉक्टर साहब पता नहीं क्या हो गया है आजकल, तो हम अपनी आंखें ही इस्तेमाल नहीं कर पा रहे. So imagine the plight when people come and say like this, that हमारी आंखें हम इस्तेमाल नहीं कर पा रहे हैं. So that this is a eye strain, this is a symptom which you are able to feel. So how we can prevent this eye strain? We have to follow these healthy tips, like practice good eye distancing. That is what I was saying. When I tell to my parents, like to children of my parents, that whenever, don't blame the online classes. You have to see that online classes are not health disturbing. It is the way you are handling it. So always practice good viewing distance, that is 25 inches. Lower the brightness of the computer should not be very high or very low. Follow the rule of 20-20, like look at 20 feet distance every 20 seconds for 20, every 20 minutes for 20 seconds. Then wash your eyes properly, not very frequently, but morning and evening when should wash your eyes. Don't splash too much of water inside the eye. Again, see to your computer settings, which is on a night mode where the blue light exposure is less. You really don't require blue filter lenses for it, because nowadays the computers and mobiles, they come up with this technique which is there where you can reduce the blue light. And if we say the blue filters, the spectacles which are available, they really don't help to that much. So basically you have to follow other things rather than just incorporating the blue light in your spectacles, and then you say okay, मैंने तो चश्मा blue light वाला इतना महंगा बना दिया, अब तो मेरी आंखें ठीक हो जाएगी. No, you have to focus on the distance, your brightness, your water intake, how you are taking care of your eyes, and how far you are sitting from the computers. You're blinking, blink frequently and knowingly. Take a break in between. Okay? So these are the ways one can prevent eye strain. So always remember that there is a need for a regular eye checkup. Different tests are done in an eye checkup. Then, because we have seen that many people go only to an optical shop, they just get their number and then they don't come for an eye checkup. No, everybody should go for an eye checkup to a ophthalmologist and get your eyes checked, because these are the things which we see. That is screen for cataract, glaucoma, any diabetic retinopathy for diabetic. So one should go for a regular eye checkup, I would say, in children as soon as possible, that is preschool. And if in adults, like every 5 to 10 years in the age of 20 to 30. And if you are more than 40, then every 1 to 2 years, if you're not having any associated other problems like diabetic and hypertension. So coming to end my topic again, as I told that in the starting, that corneal blindness is on rise, and we should take a pledge to donate our eyes and light up the life of others, so that the visually impaired can also see beauty of this eyes. So one can do their pledging on this site of EBAI organization, that is Eye Bank Association of India, where you can go and pledge your eyes, so that once you are gone, other people who do not have vision because of corneal blindness, they are helped by that thing. Thank you.